Have you ever wondered why sometimes the weight on the scale keeps going up, even when you don't feel like you're eating that much? For many people, weight gain feels like a mystery, but the truth is there are many simple and also hidden reasons behind it. In this video, we'll talk about what really causes weight gain. We'll look at eating too much, eating the wrong foods, lack of exercise, alcohol, medical conditions, medicines, sleep, stress, hormones, age, and even gut health. By the end, you'll know why weight gain happens and what you can do about it. Don't forget to like this video and subscribe to the Medical Diary of Dr. Chatterjee for more simple health tips explained in everyday language. This script is written and reviewed by Doctor Shreyashi Chatterjee, MRCP UK, Medicine Specialist, Diabetes and Hormone Specialist. The information has been collected from trusted medical books and websites like NHS, CKS, Patient.info, MedlinePlus, Cleveland Clinic, Mayo Clinic, and the American College of Physicians. So, what causes weight gain? The simplest answer is taking in more calories than your body needs, or burning too little energy to use it up. But that's not the whole story. Many other factors play a role. Let's go step by step. Eating too much. Every person has different calorie needs. A young athlete will burn far more than an older person who is less active. On average, women need about 2,000 calories a day, and men need about 2,500 to maintain weight. When we regularly eat more than this, the body stores the extra energy as fat, and weight slowly creeps up. Eating the wrong foods. It's not just how much you eat, but what you eat. A plate of broccoli and a plate of cake look similar in size, but one is very low calorie and the other is packed with sugar and fat. Processed and ultra-processed foods, things that come in packets with additives and artificial ingredients, are strongly linked to obesity and diabetes. Experts still debate whether sugar or fat is the bigger problem, but we know balance is key. Alcohol and sugary drinks. Drinks can be silent calorie bombs. For example, a glass of wine equals 159 calories. A pint of beer equals up to 244 calories. A can of cola equals 139 calories. These calories add up quickly without filling you up. That's why cutting alcohol and soft drinks is one of the easiest ways to stop weight gain. Not exercising enough. Modern life is more sedentary than ever. Sitting at desks, watching screens, driving everywhere, it all means fewer calories burned. Public Health England recommends at least 150 minutes of physical activity each week. That's just 30 minutes, 5 days a week. Exercise doesn't just burn calories, it also helps blood sugar control and protects against obesity. Medical conditions. Sometimes, health problems make weight gain more likely. Underactive thyroid, hypothyroidism, Cushing's syndrome, polycystic ovary syndrome, PCOS, heart failure or lung disease making you breathless, painful arthritis that limits movement. Even if you have these conditions, weight can often be managed with the right treatment and diet. Medicines that cause weight gain. Some medicines can increase weight as a side effect. These include antidepressants like sertraline or amitriptyline, steroids, antipsychotics, lithium, and some diabetes or epilepsy treatments. If you notice sudden weight gain after starting a new medicine, talk to your doctor. Sometimes there are alternatives. Age and menopause. As we get older, our calorie needs reduce. Activity drops, muscle mass reduces, and fat becomes easier to gain. Women after menopause often notice more fat around the tummy area due to hormone changes. Genetics weight gain often runs in families. Part of this is lifestyle, but genes also play a role. Some ethnic groups, like South Asians, tend to store fat in the tummy area and develop diabetes or high blood pressure at lower weights. Rare genetic conditions like Prader-Willi syndrome can cause weight gain from childhood. Sleep and stress. Lack of sleep changes hormones in the body. Ghrelin rises, which makes you hungry, and leptin falls, which reduces the feeling of fullness. Stress raises cortisol, which can also increase appetite. That's why long-term stress and poor sleep are strongly linked to weight gain. Lifestyle and habits. Many small things add up. Eating out with friends too often, snacking when bored, jobs where food and drink are part of the routine. Even giving up smoking can cause weight gain if cigarettes are replaced with snacks. Appropriate weight gain. Sometimes weight gain is healthy and needed during pregnancy, in children and teenagers, in athletes building muscle, or after illness when the body needs to recover. The key is knowing when weight gain is appropriate and when it's becoming harmful. Gut health and weight gain. This is an exciting area of new research. Our gut is home to millions of bacteria and other microbes. The balance of these microbes may affect how much energy we absorb, how our hormones regulate hunger, and even how fat is stored. Eating fiber, vegetables, fruits, grains, and probiotics may help improve gut health and weight control. Why does this matter? Gaining some weight is normal, but too much can raise the risk of diabetes, heart disease, high blood pressure, joint problems, and even cancer. A BMI above 30 is considered obese, and that increases health risks significantly. What can you do? If you are still in the healthy weight range, you don't need to panic. Just keep an eye on your habits. Focus on balance, regular activity, enough sleep, and stress management. If your weight is rising out of range, small changes can make a big difference. And remember, being healthy is far more important than chasing a perfect body image. Summary. So, weight gain happens for many reasons: eating too much, wrong foods, alcohol, lack of exercise, medical conditions, medicines, sleep, stress, hormones, genetics, and even gut bacteria. Some weight gain is natural, but too much can harm health. This script is written and reviewed by Doctor Shreyashi Chatterjee, MRCP UK, Medicine Specialist, Diabetes and Hormone Specialist. Information has been collected from NHS, NICECKS, Patient.info, MedlinePlus, NIH, Cleveland Clinic, Mayo Clinic, and the American College of Physicians. Don't forget to like this video and subscribe to the Medical Diary of Dr. Chatterjee for more health tips in simple language.